Hi, let's talk about high fiber and low purine diets. High fiber diet foods are foods rich in soluble and insoluble fiber. What's the difference? Fiber dissolves in water and forms gel like consistency. They help by slowing down digestion, keeping you feeling full for longer. Soluble fibers also help with lowering cholesterol and stabilizing the glycemic index or blood sugar. Sources of soluble fiber include oats, beans, lentils, apples, citrus fruits with pulp. Insoluble fiber. Insoluble fibers only functions to add bulk to stool by promoting regular bowel movements and preventing constipation. They can also help you feel fuller for longer. Sources of insoluble fibers include whole grains, nuts, seeds, vegetables, and skins of fruits. High fiber diet is indicated for patients who are constipated and they want to improve their bowel regimen, patients with diverticulosis to prevent diverticulitis, patients with irritable bowel syndrome, specifically those with diarrhea type, patients with cardiovascular disease. This helps to lower the LDL cholesterol. Also, patients with diabetes mellitus to help improve glycemic control. Also, patients who are on weight management can benefit from high fiber food because it helps you feel full for longer. Nursing responsibilities include teaching the patients to increase fiber gradually to avoid bloating or gas. Hydration, encourage fluids. Fiber needs water to work effectively. So if you're taking more fiber and less fluid, then you're just going to get constipated. Monitor tolerance, assess for diarrhea, bloating, or discomfort. Individualize especially for patients who are in acute diverticulitis, you do not want them to be on a high fiber diet. You want them to be in a bland diet or NPO during the acute phase. Collaborate with the dietitian to tailor fiber into the patient's condition. Okay, now let's move on to the low purine diet. A purine restricted or low purine diet is prescribed to reduce uric acid levels in patients with gout, kidney disease, or certain metabolic disorders like hyperuricemia, which means elevated uric acid levels in the blood. Limits food high in low purine, meaning we limit foods high in purines. Purines are found in organ meats like liver, kidney, brain, sweetbreads. Also, purines are found in seafoods like sardines, shellfish. They're also found in red meats, alcohol, especially beer, and high fructose corn syrup. So, know these sources of purine because if a patient who has gout comes to you or they have an issue with kidney stones from uric acids, please know the different kinds of foods that you need to teach them to limit. The body breaks down purines into uric acid. Excess uric acid can crystallize in joints, causing gout, which can trigger painful gout attacks. Some of the nursing responsibilities would include teaching the patient to link between the purines and the gout attacks, monitor labs like the uric acid levels and the kidney function, encourage hydration. Hydration helps prevent uric acid crystallization in the kidneys especially. Assess adherence to the therapeutic diet. Coordinate with dietitian to ensure adequate protein intake from low purine sources. So patients should be able to know which are the sources of protein that can still provide protein but doesn't have purine or high levels of purine. Thank you for watching and see you on the next one.